The shoulder joint is a flexible ball and socket joint formed by the junction of the humerus and the scapula. It is a crucial joint in the human body as it allows various upper body movements that are often used in everyday life. Overhead sports such as tennis, baseball, and volleyball heavily rely on the shoulder. Unfortunately, overuse can often lead to injury for many of these athletes. Throughout this video, we will be analyzing shoulder injury specifically in volleyball. Prehab shoulder exercises are crucial for athletes playing overhead sports. Simple exercises can strengthen the shoulder and reduce risk of injury. The following stretches being demonstrated in this video are highly effective and release tension in the shoulders. They are used to stretch the rotator cuff and are often used in pregame warm-ups. Hold each stretch for about 20 seconds, then switch sides. This exercise is great for strengthening the scapular muscles and stabilizing the back muscles. Resistance bands are great for strengthening your muscles, but they are also beneficial for prehab and helping avoid injury in the first place. Using resistance bands for shoulder exercises can improve functional fitness, all while decreasing shoulder pain in those areas that are injury prone. The resistance band lateral raise demonstrated in this video is an excellent movement for strengthening the deltoid and will help to increase the stability of the rotator cuff. Volleyball players use a lot of repetitive overhead motions in practice and during games. One of these motions is hitting. Repetitive hitting is demonstrated in this video. Without proper warm-ups, the shoulder can very easily become injured. Overhead serving is another very common motion in volleyball. Many shoulder muscles are activated while completing this motion. When an athlete experiences overuse of the shoulder, serving can quickly become a very challenging and painful movement, especially for those who experience shoulder impingement. Shoulder impingement or bursitis is common in many volleyball players. Usually, there is enough room between the acromion and the rotator cuff so that the tendons can slide easily underneath the acromion as the arm is raised. But each time you raise your arm, there is a bit of rubbing or pinching on the rotator cuff tendons and the bursa, causing inflammation and pain or discomfort. This is known as impingement syndrome. If impingement syndrome isn't properly treated, it can turn into a more serious injury such as a rotator cuff tear. Continuous overuse of the rotator cuff tendons cause the muscles to wear down. The picture above shows tendinitis, which makes the muscles look like they are fraying. It also shows a tear that can occur if tendinitis goes untreated. There are various types of treatment for shoulder injuries. These include anti-inflammatory medications, rest from activity, stretching and physiotherapy, as well as surgery if the injury becomes serious like a rotator cuff tear. Thanks for watching our video on the shoulder joint.